She's standing in the kitchen. Her child is crying. It's the end of a long day, and the crying has a particular quality tonight. The inconsolable kind. The kind that used to hit something in her and set the whole system firing. She notices the familiar arrival, the edge of something coming, and then she waits for what always comes next. It doesn't come. There's a space where the wall used to be. Not a gap she created consciously, not a technique she applied, not a pause she forced herself to take. Just a space. Unfamiliar, quieter than she expected. Her child is still crying, and she can just be there for it. Not performing being there, not white-knuckling her way through, actually there, present. The crying landing in her without detonating anything. She told me about this moment afterwards. She said, I didn't do anything differently. Something was just different. That's what resolution looks like. Not doing something better, something having changed. Welcome back to The Family Architect. I'm Philippa Scott. This is episode 37. It's the fourth episode in the attachment trauma series, and the one this whole arc has been building towards. We've spent the last 3 episodes establishing the problem with a level of clinical precision I haven't brought to this show before. In episode 34, we named the wound, the attachment trauma wired into the nervous system from childhood, running a protection program that fires before the mind can intervene. In episode 35, we looked at the 5 directions the wound goes. In episode 36, we went inside the 2-second window and explained exactly why the techniques work on the wrong layer. Today, we turn toward what actually works. I want to be honest about what this episode is and isn't. It's not a sales pitch. It's a genuine description of resolution, what it means, what it requires, what it produces. Because I believe you deserve that description as fully and honestly as I've described the problem. You've earned the right to know what's possible, specifically, not just that something is possible. Let's go. I've used the word resolution throughout this series, often in contrast to management and coping. Today, I want to be precise about what I mean. Resolution is not getting better at handling the hard moment. It is the hard moment becoming genuinely different. Here's what's happening when the reactive pattern fires at a physiological level. There is stored material in the nervous system, an old experience, an old association, an old threat response that got locked in rather than completed. And when the right stimulus arrives, that stored material activates. It adds its charge to the current moment. And suddenly, the current moment is carrying the weight of every similar moment that came before it. Your child cries. The stored material activates. The nervous system responds not to the cry in front of you, but to the accumulated weight of every time something like this was dangerous. The response is disproportionate to the present because it is proportionate to the past. Resolution is when that stored material has completed, when the old experience, the one that was locked in the nervous system rather than processed, has fully metabolized. The stored charge has discharged. The nervous system is no longer carrying it. When this happens, the stimulus arrives without the weight. Your child cries, the nervous system assesses, child's having a big feeling, difficult, I can be here for it. Not safe to unsafe in a millisecond. Difficult, I can be here. That's not a better response to the same experience. This is a genuinely different experience because the thing that was making it so threatening has been resolved, not managed. This isn't a metaphor. It's a description of what actually changes physiologically when stored trauma resolves. The approach I use for this work is called the Richards Trauma Process, TRTP. developed by Judith Richards in Australia, right here on the Sunshine Coast. It's a structured trauma release process that works directly with the subconscious and the nervous system rather than primarily with the conscious narrative. I want to tell you why I use it specifically, because there are other trauma-informed approaches in the world and the choice matters. The first reason is that it works where the wound actually lives. We established in episode 36 that the attachment wound is encoded in the part of the nervous system that predates language, before the capacity for narrative, before the capacity to reason about experience. Talk-based approaches are limited in how far they can reach into this material because the material does not live in language. It lives in the body. It lives in the physiology, in the reflexes, and the sensations and automatic responses that run faster than thought. TRTP works in the body's stored experience directly, in the unconscious, which is running the body. And it does not require you to relive the trauma in painful detail. It works with the nervous system's relationship to the material, not a detailed excavation of the narrative. You do not have to go back and tell the story of your childhood in full. What needs to change is the body's response to what happened, not the story of what happened. The second reason is that it's finite. I want to pause on that word because I think it matters more than it sounds. Finite means there's a beginning, a middle, and an end. It is not open-ended. It's not indefinite therapy that continues for years with no clear completion point. The process has a structure. It moves through that structure and then it is done. In the sense that the specific stored material has been resolved and the nervous system relationship to it has changed. The loop is closed. And the little girl or boy inside you who has been carrying the protection program for 30 years, the idea that this has a completion point matters deeply. They've been waiting a long time. They don't need to wait indefinitely for the message that can be put down. Third reason, it worked for me. This therapy saved my health and my mental health years ago. I know it works. I've experienced it. I want to describe what TRTP actually involves because the unknown is often scarier than the reality. The work happens across 3 2-hour sessions. There's a 1-month follow-up call, and if something needs a further session after that, it's included. In the sessions, we work in not a deep state of relaxation. It's not hypnosis in a dramatic sense, but in a state in which the thinking brain steps back enough that we can work with the subconscious material. We use your imagination. The process doesn't require you to produce a detailed narrative account of your trauma or to relive it in vivid, distressing detail. It works with the nervous system's held response to experience, the stored threat state, rather than the content of the memory itself. Most people describe the experience as surprising in how undramatic it is. There's often emotion, sometimes tears, sometimes grief, sometimes relief, but not the sustained distress that people often anticipate when they imagine trauma work. The process is designed to metabolize the stored material rather than to reactivate. What happens after is harder to describe in advance because it is genuinely individual. But the pattern in what people report are consistent enough that I want to name them. Let me tell you what the parents who do this work come back and describe. They rarely describe it as, I've learned to manage the hard moments better. They describe it as, the hard moments are different now. The thing that used to set them off, the specific quality of their child's distress, the particular tone of voice, the end-of-day sensory overload, the moment when they heard their own parents' words forming in their mouth, that thing arrives and something has changed about how it lands. Can still arrive. Life's still hard. Children are still demanding and inconvenient and developmentally committed to having enormous feelings at the worst possible times. But the charge is different. One parent described it like this: I used to feel like my child's crying was pulling me underwater. Now it feels like I'm standing on the riverbank. I can see it, I can reach in and help, but I'm not in it the same way. Another described noticing about 3 weeks after completing the work that she'd had an entire evening of difficulty. The child was unwell, nothing was going right. It's the kind of evening that would previously have unraveled her. And at the end of it, she realized she'd been present for all of it. And not just performing presence, actually there. Another described a particular strangeness of waiting for her mother's voice to come out of her mouth in a hard moment and it not coming, just her own. A voice she'd been trying to find for years, suddenly available. These are not people who learn to cope better. These are people whose nervous system's relationship to the material changed. The protection program that was running has been stood down, not suppressed, not managed, stood down, because the stored material that was powering it has been resolved. The little person inside them got the message, finally, that the emergency was over, that she can put it down. And now they feel light, calm, at peace, energized. I want to be honest about some of the things resolution does not do, because clarity matters more than enthusiasm when you're describing something this significant. Resolution does not make parenting easy. Children are still children. Life still produces difficulty. The nervous system still has a stress response, as it should, because not all stress responses are wounds. There will still be hard days and hard moments. Resolution means you move through them differently, not effortlessly, differently. Resolution of one stored wound does not automatically resolve them all. TRTP is targeted work. The material we address in the process is specific, and it works to reactivate the hippocampus. That allows the memories to be stored away, to close the loops. We don't have to work on everything. Whilst the resolution happens very quickly, the nervous system may take a little time to integrate what's changed. And the people around you, well, they can take a little while to relearn how to treat you. And you can take a little while to integrate back into the life that you've created so that it works for you better. And resolution is not a substitute for the other parts of this work. The regulated mother method that contains TRTP is called a method for a reason. It's a methodology with multiple movements because the work of becoming the family architect requires more than one thing. TRTP is the release, the resolution of the stored material that was powering the reactive pattern. The other movements are the rebuilding, the regulation practices, the relational work, the conscious construction of the family culture you're building. But release is where most parents need to start, because trying to build on a foundation that is still actively undermining you is like renovating a house in an earthquake. The tremors need to stop before the building can hold. I want to be specific about who the TRTP work is the right next step for, because it is not for everyone in every moment, and I would rather be precise than have the wrong person enter the process before they're ready. This is for the parent who has done surface level work and knows in the body, not just in the mind, that there is something deeper that hasn't shifted. The one who understands the theory, has the scripts, knows the framework, and still ends up in the same place. Who has reached the limit of what awareness can do and can feel that limit clearly. This is for the parent who can say, yes, that's me. I'm in the pattern. I know it is not who I fundamentally am. I want to resolve it, not manage it forever. This could be the first step for you, or it might be the 50th step for you. Being ready looks different for everyone. If you're in crisis, please reach out for immediate support. And if you're not sure whether you're ready, If this series has resonated but the leap to the deeper work feels like a lot, the wired quiz is the starting point. It's 8 minutes and it names your specific pattern. And from there, the path becomes clearer. I said earlier in the series that I didn't come into adulthood with secure attachment, that I had to earn it. I want to tell you a little bit more about what that means because I think the personal matters here. I did this work, not all at once, not in one revolutionary moment, in a deliberate, non-linear, sometimes grinding way that this kind of change actually happens. I went into the material I'd been carrying. I let it resolve rather than manage around it. And I came out of it not as a completely different person, but as a more complete one, with access to parts of myself that the protection program had been keeping locked. The thing that changed most was not what I expected. I expected to stop reacting. What actually changed was that I started to feel safe. Not safe in a naive, nothing can touch me sense. Safe in the body, settled, present. The baseline level of vigilance that I had always just thought was my personality turned out to be a protection program that could be resolved. And from that settled place, parenting is different. Not easy, different. The moments that used to require so much of me require less. The presence I was performing became genuine. The repair conversations that I used to find agonizing became something I could do without the shame spiral that used to follow them. I'm not describing a destination. I'm describing a shift in the foundation that everything else gets built on. And I believe that shift is available to every parent who has listened to this series and recognized themselves in it. The little child inside you built their protection program because they needed it. They've been doing their job faithfully for decades. And they're ready, I suspect, to receive the message that the emergency and danger is over. That message is what the work delivers. 2 pathways are in the show notes, depending on where you are right now. If you're ready, if this series has named something you've been sitting with for a long time, and you know the deeper work is the next step, the TRTP intensive and the regulated mother methods are both in the show notes. The TRTP intensive is the standalone resolution work, 3 2-hour sessions, a 1-month follow-up call, and a 4th session included if you need it. The regulated mother method is the full container. TRTP sits inside it as the release movement alongside the full methodology. Both pathways are there, and an alignment call is the starting point. It's also linked. If you're not there yet, if the series has landed, but the leap feels like a lot, the wired quiz is your next step. It'll take you a few minutes, it names the specific pattern, and from there the path becomes clearer. That link is also in the show notes. Thank you for staying with this series. It's been the most important work I've put into this show. And we're not finished. Next week, we go into what the rebuilding looks like on the other side of resolution. The regulation practices, the family culture. Becoming the family architect is not an aspiration, but a lived daily practice. I'll see you there. I'm Philippa Scott. This is the Family Architect.